The nurse would come into the room presenting herself to the patient, and then we'll start a general survey.
Hi, my name is Nicole Phillips. I'm going to be your practical nursing student today. I'm just going to ask you a few questions regarding the pain that you're in today. Is that okay with you?
Yes.
Alright, so first off, can you state your full name for me?
Nadine Padard,
And how old are you?
20,
Your date of birth?
March 20th, 1998,
Your gender?
female,
Can you tell me your ethnicity and your race?
so Caucasian and French Canadian.
Do you currently live with anybody?
Yes, my boyfriend.
Okay. Are you taking any medications currently?
No,
And can you tell me the main reason of why you're here today?
I've been having some chest pain for a while.
The nurse would then proceed to ask questions relating to her pain using the PQRST scale as well as their family history.
Alright, so does anything relieve your pain?
Not particularly.
Can you describe the pain?
It's like someone sitting on my chest, and it's like someone stabbing like a doll.
Okay, does anything aggravate that pain?
No, nothing I can pinpoint.
Okay. Where exactly is it located?
Dead center of my chest.
Does the pain radiate anywhere else besides your chest?
It just stays there.
Okay, can you rate the pain on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain you've ever been in?
So usually when it happens, like a 7.
A 7? Okay. Do you recall what you were doing when the pain started?
Usually I'm at work when it sometimes happens.
And how long does it normally last?
Like half an hour to an hour.
And do you know if you have any family history of heart conditions at all?
Yes, I do.
The nurse would then start a physical assessment of the patient. They would come into the room, hand sanitize, and provide privacy for the patient. The nurse would be inspecting the patient to see if there are any physical deformities. They will note if her face and body is symmetrical in all aspects, and will observe for any skin differences that do not correlate to her ethnicity. They will also examine for any noticeable edema. In addition, because the patient is presenting with some cardiovascular symptoms, the nurse would inspect the anterior chest to see if there are any noticeable heaves or lifts, which are described as forceful thrusting of the ventricle during systole. The nurse will then perform the palpation of the apical impulse. They will use one finger pad to locate the apical impulse on the 4th or 5th intercostal space.
Now can you exhale and hold it for me?
Apical impulses are not palpable in every patient. It is not palpable in obese patients or those who have thick chest walls. The nurse will then palpate the precordium by using her palmar aspects of the fingers and placing them over the 5 sites, which are aortic, pulmonic, Erb's point, tricuspid, and mitral. They will be looking for the presence of any palpable vibrations.
There's no palpable vibrations.
Next, we'll also take the 4 valve areas where sounds produced by the valves are best heard. In normal instances, the patient would not have any clothes on. This would affect listening to these sounds. I will be using the diaphragm for the high-pitched sounds.
Is that okay with you?
Yes. I will be examining the heart to note the rate and rhythm, identifying S1 and S2, listening for any murmurs or listening for any extra heart sounds. No irregular rate was present during my auscultation, and there was a consistent rhythm. The heart sounds are classified as S1 or S2. Any other sounds present would be considered abnormal. S1 is the first heart sounds that will occur. This occurs due to the closing of AV valves. S1 is heard louder at the apex. S2 is the second heart sound that occurs with the closure of semilunar valves. S2 is heard louder at the base. No murmurs were present during auscultation. Murmurs are blowing, swishing sounds that occurs with turbulent blood flow in the heart.